Did you know that your race, income, and zip code affect kidney care? Disparities exist from dialysis to transplantation and end-of-life care. This video explores racial and social inequities and how to change them. End-stage renal disease. End-stage renal disease is one of the toughest health challenges. Social factors like poverty, housing, education, and insurance heavily impact patients' lives and survival. Barriers to kidney care. Immigrants, nursing home residents, behavioral health patients, rural and urban underserved, the unhoused, and uninsured face disproportionate challenges accessing care. Lack of transportation, storage, and interpreters limits home dialysis and transplant referrals. Barriers to transplantation. Financial issues including insurance, travel, housing, and parking costs. Language and cultural barriers limit understanding of care options. Lack of social support required by transplant centers. Systemic challenges faced by patients. Patients labeled non-compliant often face costs, transport, and communication struggles rooted in systemic issues. Palliative care gaps in kidney treatment. Palliative and hospice care bring dignity when dialysis fails but are underused due to focus on metrics, cultural norms, and mistrust. Delayed palliative care in marginalized groups. Marginalized patients often receive late palliative care, leaving families unprepared and unsupported during end-of-life stages. Case example of a patient facing challenges. An immigrant ESRD patient attending thrice-weekly dialysis struggles with language barriers and no interpreter, limiting knowledge about transplant and palliative care, overwhelming her family. Culturally competent navigators improve patient experiences. Support by navigators fluent in patients' languages makes kidney care journeys more informed and supportive. Structural inequities in kidney care. Rural patients travel far to transplant centers. Telehealth helps but requires internet and technology access. Urban parking fees can restrict access to care. Solutions to reduce disparities. Train providers for compassionate and honest goals of care talks. Expand telehealth and transportation support. Provide hospice education, culturally competent navigation, and peer support programs. Impact of the solutions. These approaches empower patients with informed, values-based decisions and promote equity in kidney care. Future of kidney care. Combining medical treatment and social justice ensures all patients live well and die with dignity, regardless of race, language, or income. Summary. Racial and social disparities heavily influence ESRD care outcomes. Tackling these requires patient-centered and culturally sensitive approaches across all treatments. If this video helped you, please like, share, and subscribe to spread awareness about equity in healthcare.